While some Democrats keep repeating illegal immigrants can't access federal spending, new research shows they do, and it goes well beyond the billions in health care and public education. Open the Books discovered illegal immigrants have benefited from at least $200 million in direct federal health care related grants, and that's just the tip of the iceberg. Joining us to discuss, Deputy Public Policy Editor for OpenTheBooks.com, Rachel O'Brien. Good morning to you, Rachel. What's included in this grant spending?
Yeah, good morning, Jan. So these are grants for healthcare research and programming, specifically with the word undocumented in the grant description. There's likely much more spending like this, but harder to find because it doesn't specifically say it goes to undocumented immigrants, even though in many cases it does. So what the $200 million doesn't include is the $27 billion that federal and state governments already spent between fiscal years 2017 and 2023 on Medicaid services for people who are undocumented. This is for emergency Medicaid services if they're ineligible for full Medicaid coverage because of their immigration status. So we already know $27 billion goes to that. And it also doesn't include education spending that benefits illegal immigrants and their children, and that amounts to an estimated $70 billion annually. So this $200 million is a very small portion of what we know.
So give us some examples of these grants.
Yeah, so $4.3 million went to Stanford to study people in California who were in a pilot to test universal basic income. So California was giving people money, including legal immigrants. And so $4.3 million went to Stanford to study this, to look at how it impacted their cancer risk. $2.4 million went to UCLA to study reproductive health care for immigrant Asian women, including undocumented women. $1 million to the University of Miami to study drunk driving for undocumented immigrants. They say undocumented immigrants were less likely to understand DWI laws. They wanted to study them. $4 million went to Southern LA County to build a community medical wellness center for undocumented populations. Another $2.5 million in East LA for a similar health center for those, many of whom are undocumented. New York, same thing, $1.5 million for an area that has a very large undocumented population. And there are many more examples of this.
Yeah, and it sounds like California really getting the most funding out of all this.
Yeah, we see the largest ones. There was another $1 million for a clinic for services for, again, homeless and undocumented populations. So California is the #1 spender on this list, almost $66 million since fiscal year 2021 in these grants, and then Florida at $26 million, DC at 22, New York at 17. Of the $200 million we're talking about here in these grants, specifically for undocumented immigrants, $158 million went to programs providing direct services as opposed to scientific research. There was some research, but mostly it's going directly to this population. So the next time someone tells you, illegal immigrants don't get federal money, you'll know the truth.
Yeah, and as you said, a lot of this is coming from the Department of Health and Human Services.
Right.
All right, Rachel, thank you so much. I hope you have a great weekend.
You too. Thank you, Jan.